Everybody, welcome. Miracles, Magic, Healing, and Coffee show. And we probably won't have Jen on, but we should have Dr. Tom on in a little bit. I'm going to see if I can stream this on Facebook. For some reason, my streaming on YouTube isn't working right now. And so this will be on a little later, but I sent you guys an email if you're on our email list. I'm going to see if this will work on our Beyond Limits page, just in case. I'm having technical difficulties today. Oh, it looks like it's going to work. Copy. And Dr. Tom today. I'm going to do it on toxins and viruses. Let's see if it works, at least like that. Okay, set a title. So for some reason it's working on YouTube now. Oh, maybe not. There we go. Okay, so it's going to be on YouTube. So we're waiting for Tom. So I had an interesting time this morning, and I was going to do an extra video. And it was because I had I had remembered something from the past. So I'll wait for Tom. I'll just tell you this little story. And I was busy in San Diego working my clinic, Mission Hills Physical Therapy, an integrative manual therapy practice, matrix energetics, all sorts of stuff. And I was running on the weekend before the class, before starting a regular work week. This is many years ago. And I fell really hard in Ocean Beach, California on the cement, and finished the run. But then it was obvious I was pretty hurt, probably did a sprain of my AC joint. And then I couldn't work. So I spent the next few days unable to work. And instead, my life, instead of being super busy, I was just hanging around the house. I'd walk to work. I'd get one of my therapists to work on me. I'd walk home. I really couldn't use my hand. And even if I tried to run, my hand would swell up. So I was really out for a while. And partway through that time off, we had a regularly scheduled Qigong practice. And my Qigong teacher, Federico, walked in, and he was used to me being busy till the last minute and then getting ready to just do Qigong and do 2 hours of Qigong and then go home and then be busy again and just go from one busy thing to one busy thing. And instead of being back in my office, I was in the waiting room just sitting there because I had nothing to do for a few days. And he walked in and he just stopped. And he said, "Smells like death. I like it." He could feel something. And so I was in a big, what's called a pattern interrupt, I keep looking over to see when Tom shows up. I was in a pattern interrupt. I had been slapped in the face. I'd been stopped right in my tracks. And kind of like when I was walking across the street one time before that, I think it was before that. Yeah, definitely before that. And I was so mad. It was New Year's weekend, New Year's like 2nd of January, and I was walking to get my takeout food. And I was just so mad about a bunch of stuff, mostly because of just some stuff. And I got hit crossing an intersection. I was walking and I got hit by a car, and then I was down on the ground again. And that was another period of just having to hang out, get therapy, and wait. And so on this few days ago, week or two ago, I was running and on a trail. I don't tend to fall, but I fell hard on a trail. And there I was just going from where I was in my mind talking and all sorts of stuff going through my mind, even though I was on a beautiful trail. And then instantly I was on the ground and I was just laying there. And what came to me instantly was just stop fighting. So I was going to talk about stillness and pattern interrupts and being thwarted. And then I went to put the interview on to do the video this morning, and none of my streaming technology works. It still doesn't work. So right now we're just recording to watch later. Keep looking over to see when Tom shows up. Maybe Tom won't even show up today. I don't know. But what I got was those reset moments. The whole world is in a reset moment right now. You know, if you're watching this live or whenever it's released, we're in this lockdown and we don't know when it's going to restart, or if it's going to restart the same way, or what the world's going to look like. And so we're in a bit of pattern interrupt. So for some reason, this is streaming on my Beyond Limits page. It wasn't doing that earlier today when I wanted to do it. Still unable to stream on YouTube. Tom may or may not show up. Jen, I'm pretty sure, is not going to be able to show up. I've got a lot of stuff on my to-do list. Got all sorts of plans. But instead, I'm just sitting here. And so what you might want to do, if you're with us here, if you're here, is to take your attention inward and use your mind. Our mind likes to have something to do, you know? To say sit in stillness, your mind will go crazy. It's like a mind doesn't want to do that. It wants to do something. So what we can do, if you like, is to use your mind and give it a task. And its task is to go inside and notice what's happening in your body right now. So for the next few moments, while we see if Tom is showing up, or if we see Jen is going to show up, we can sit in this stillness, and let's give our mind an assignment to go inside and notice what's happening. What's happening in your body right now? And even though your mind wants to do something, let's see about giving it one task, and that is to stay inside with your awareness inside your body and notice what's happening. Just stop fighting. Stop trying. I had a Facebook post that one of my coaches put out. He was so mad because he uses ethical principles to help business people online business people get their message out to the world. And he insists that people do ethical things, that they use his techniques and his coaching only for good. He won't take somebody if they're doing something unethical. And he noticed there was a group that was teaching people how to cheat on their wives, how to have an affair, and it had 65 million users. And he was so mad. It reminds me when I was getting worked on with integrated manual therapy many years ago. Tom's wife, Sharon, had her hand on my heart. I was in Albuquerque, New Mexico, and she was working on me. And for some reason, something came up about a pattern of every single girlfriend I had was really pretty. I always had pretty girlfriends, beautiful girlfriends, but they had a certain trait. Every single one of them cheated on me at some point. And Sharon didn't miss a beat. She looked at me and she said, "You need to go inside and think of the 25 ways that you disrespect women." And I was like, "Are you kidding me? They're the ones that cheat on me." But I went inside and sure enough, I found all sorts of ways I had been disrespecting women. Yeah, so if something pushes our buttons, some evil person that's doing something you don't like, somebody that's doing things wrong, child crying in another room, if something pushes our buttons, what might it be like to go inside and just sit with it? For me, it'd be very easy, and I can see myself doing this a little bit right now, thinking I should check my email. Is Tom trying to get on? Yeah, what would it be like to stop fighting? Stop judging. Stop blaming. Stop criticizing. To use your mind, give it that task of paying attention to what's happening in your body right now. Stop teaching. Stop learning. Stop letting go. Ben was in a piano lesson quite a few months ago, before all the lockdown, before stuff, and his piano teacher, love him, had Ben write a song, and he said, "What's the name of it, Ben?" And Ben said, "Pepperonis and Pakoras." And I knew what it meant, because after a full day of hanging out with me and his brother Baden on the trails one day, he it was so amazing. And then at the end of the day, we were sitting by the trailhead by the car eating pepperonis and pakoras on a log. And Ben said it was the perfect day. Nothing needed to change. Everything is perfect. Nothing needs to change. That's what he said. Yeah, what's it like just to be inside your own body, using your mind to notice what is happening in there? Oh, there's Tom. This is going to be good now.
Hey Ralph, how are you?
Good, real good. I hope you weren't having technical difficulties, but
A few to get in today, and I'm not seeing any camera settings.
well, let me see. Maybe it's let me move you to panelist, I think. Let's see. One of the things that Tom will be coming over to panelist in a second. I think he's going to still be there. There he is. Let's go see. One of the things that the integrated manual therapy world taught me years ago was and we got to work on what's called our limbic system a lot, which is basically the fight or flight survival, like survival mode part of the system, because we're always learning new stuff. Always learning new stuff. In fact, one of my teachers, Kim Burnham, she told me years later, she goes, yeah, I was never even comfortable. I'd come back from teaching a class and there was all this new technology and terminology. And so we were always working on our own limbic systems because it was never going to get just totally comfortable. so anyway, we were working on some deep stillness stuff before you showed up, because I had a lot of stuff happen today that all my plans were thwarted. So this is actually being recorded, and I got to just put it up on YouTube afterwards, because I couldn't stream it to YouTube. I couldn't stream it to Facebook. Now it is streaming to Facebook, to the Beyond Limits group. But man, have I had and it's funny because before I got on, I was reminded, I was telling everybody about when I had was really busy in San Diego in my practice, this mission physical therapy, but then I fell one weekend running and I couldn't work for like a week and a half, 2 weeks. And I got everybody working on me. But besides that, I was just not working. And so I was waiting for Qigong, and my Qigong teacher, Federico, showed up and he just stopped. And he said, before he even said anything, I was just waiting in the waiting room, just sitting there. And he walked in and he stopped and he said, "This feels like death. I like it." And he could tell that just like I was in a huge reset. And right now we're in this reset lockdown thing where it's like being thwarted, nothing to do but be still. And maybe there's a new way to work. But today, as I was getting ready and I sent you a message, I was thinking, how do we, the idea of like living with a virus or fighting a virus, and there's a ton of viruses and bacteria and stuff living in that world, and also toxins. Like yesterday, I was out by the bay, and it was low tide, and there's been a lot of industry in this town over the years, and so the bay is really polluted. And I swear I got home and I was like, oh God, I think I feel toxic. And so the idea of like, how do you get strong enough to live in the world, and then do you avoid toxins and viruses? Do you just get strong enough that you can hang out with them? So I thought that might be a good entryway to hear what you have to say about that from the IMT and any other perspective you have, and just anything else you want to talk about.
Okay. Well, I do agree that the world is toxic. It feels like, this surrendering to the virus and sheltering at home has brought up a lot of different layers of interconnectedness. And a lot of speakers and a lot of philosophers are saying we're moving into a new cycle of consciousness where we also have to think about community and ourselves at the same time. It's pretty weird that people are shifting from just me to what about us, and how do we work as a village and a community. And that's, we've said the words before. We thought we were doing some of the words before, but a lot of the world has not been that way. And I think there's a huge shift in the consciousness of going that way. Part two, I think there's an old school format of just me and me first. And that's very primitive and angry, and they're losing control of how to manipulate the general public in that way. So it's been interesting to have discussions on consciousness and evolution. I've been writing since 2005 as we moved into a different world of consciousness. And we talked about that golden heart energy before, Ralph, and how that's important to feel from your heart. And, as kids, when we were growing up, it's like, just don't say anything, don't tell anybody anything, don't tell people that you feel things, and to shove that down. In this generation, we're really becoming aware of those pieces. And I just finished a new evaluation, and what I found in this year that in the last year and a half, we used to have people say, I used to ask the question, what stresses you out? And I had some 20-something people come in their 20s, and they said, global warming, health of the earth. And I had never really seen that in a history before as a traditional muscle skeletal sports medicine type of process. And tonight I had somebody that was worried about the sheltering at home, the presidential elections, and we're taking these mental concepts and really bringing them into our body differently than we've ever done before. Right? As far as the pollutants in the world, there's a lot of toxicity out there, and there's a lot of unhealthiness, and there's a higher prevalence of people having allergies and intolerances to things. But we have to figure out, how do we make ourselves be able to have enough stature to deal with these things. We created them over generations, and now we have to deal with those pieces at the same time. And there's been a global series called The Truth About Vaccinations. You can Google it. And It's been a 7-part series, and it's been interesting to hear all the world experts in functional medicine talk, and how we've been adding additives since the early 60s and 70s. Even DDT, which was this superb pesticide, was in the 50s. And you go back to the old videos, kids were jumping in the streams while they were spraying it on the streets, and they found that it was causing all these developmental, and now it's illegal to even have that. Or if you go back to cigarette smoking in the 40s and 50s, and the doctors were recommending it, and it was sponsoring, all the commercials and everything else. And now it's an intolerance to the world. So we've been adding a lot of junk into the world, where we're coming out of, the agricultural society. In the 1900s, we added the industrial society. We added radio waves that weren't there before. These are new energies that are in the fields, to bodies that were used to sunshine, go to sleep when the sun goes down, eat the foods that were there during the seasons. And now we're making man-made stuff, and we've lost connection with the earth. A lot of not being of ease is disease, right? So how do we really look at all those planes of, what am I putting in my mouth? Am I supposed to eat watermelon every day? Or am I supposed to be able to go to the grocery store and buy a bunch of grapes every single day of my life? Or should I be eating squash during the fall and green vegetables during the summer? We've really lost the connection of how we get our nourishment per pattern of what the universe or the world used to provide for us at the same time. And I believe that's really causing a lot of dysfunction in the world today.
Yeah, I wonder, what do you think? Because I've got there's a certain thing in integrated manual therapy, plate therapy. So I'm like on the subcortical plate and on the adrenal plate, and it's like, one thing that IMT taught me was to clear those things in me that were causing angst, and then we could come from a better space and then decide what to do. So it seems like is there like a work on yourself to be not so affected, emotionally or mentally or spiritually, or limbic system, but then also in the real world you don't need to smoke cigarettes, and it's not like we need to get so evolved that we just smoke cigarettes and have whiskey every day and it doesn't bother us, and be on our cell phone all day. Like, what do you see as the balance of like letting go and surrendering, clearing your the rage and survival stuff, yet not just saying, well, you can do anything you want as long as you're evolved or something. There's people that actually talk about that. There's a doctor, the late David R. Hawkins, that says, well, if you're in love and acceptance and peace, all these toxins don't bother you. And I'm thinking, I still think toxic vaccines and Roundup and that stuff, I think it would still bother most people. Even if even if Jesus was down here, he might feel it. I don't know. What do you think about all that?
Well, I believe, be smart about the stuff you put in your body. And, what they said in the vaccination, a couple of highlights of that is that, the amount of injections and the amount of chemicals put in your body for vaccinations back in the 60s, 70s, and 80s was totally different than, I think there's 66 doses of certain vaccinations that you need to have. And I feel one of the things that scares me about this sheltering at home is that we're setting up for more of those chemicals being pushed by the government.
And shouldn't we be like around people with infections so our immune system plays with it, instead of like, if you're sheltered and all of a sudden you're back out in the world and these toxins and things, these viruses are there that you were kind of sheltered from for a bit, now you're exposed all at once. Isn't there some benefit to like be in the mix?
Yeah, the way of a minimal public health process is that some people they're showing that some people are getting have the virus in their bloodstream and they haven't presented, and sometimes they're even like coughing on other people and they may have an issue with it. And then there's another thing called herd immunity out there, but the sheltering at home has just slowed down the process, so that we could have enough space that Western medicine could fix the sick people as fast. But it's still, like 2 weeks ago, I had all my antibodies tested from a laboratory, part of a screening, and I was assisting them while they were getting their FDA approval. And that showed that I haven't had the antibody yet. So that means I haven't been influenced by this flu. So I I'm still as susceptible as today as when I went into isolation. So there's the theory that, we still have to get everybody inoculated to it somehow. And one of the fears is that we have the government saying, well, just take this vaccine and we'll be safe. After that point, I would prefer to do the old thing of actually challenge my immune system to the full virus, with the risk of 1 out of 1,000 people do have the infection of the lungs and the virus, because the virus can cause those things too. And we know through other vaccinations that it's not the most complete safety thing out there, that there are illnesses per vaccination that have side effects. Part two is we are our own experimental process over time. So I grew up in Connecticut, you grew up in California. So what were the pesticides sprayed in your town versus my town? Even if we both swam in swimming pools and we had chlorine, how does that influence us over time? How many times have we taken plane trips? All that adds up to our tolerances and abilities. What I find kind of amazing about IMT is we have a clinical way of touching the body and seeing where the stresses are. And it's an old osteopathic saying, you get 1,000 extra bonus points and then you have disease. So if you can find those 1,000 extra bonus points and reduce 100, 200, 400, you're less likely to present with a disease process on the other side of it. But what I really like about integrated manual therapy was we would touch somebody's body and walk through it. So I had a very interesting case today, a woman in her 60s. She's a singer and a pianist. And she said she got a flu in August and respiratory piece, and she lost her vocal cords, and she's got diagnosed by the medical community that she has paralysis of her vocal cords. So she's seeing a speech therapist, and they measured all this, that one set of muscles not working than the other set. But in 2017, 3 years before, she slipped on the ice and broke her wrist. So it was a very interesting pattern that we saw, that it was like somebody shortened. It was like somebody took a sweater and tightened up the sweater on all the right side. And we could see how it even pulled up into her ear, right? And I went and yeah. And so she fractured her wrist. She had 10 pins in it, 2 plates in it. She got over it. She went back to playing piano, and she said she doesn't have she has a little minus of her flexibility to reach the keys the way she used to. But adding all the big picture up, we saw this whole story. Nancy and I saw the whole story, and we actually mapped out how the wrist is still affecting all these pieces, right? And I just had her her hearing even it was like she had a body mask on, a full unitard, and squeezed and pulled everything up and pulled it all together. Yeah. And all that got tight, and it even affected her ear. So after I mapped her, I said, okay, I bet you have hearing loss on your right side. And I took a tuning fork and made her listen from distances, and she was 6 inches less hearing the tuning fork on the right side. She goes, how did you know that? I said, well, it shows up on the map. Yeah. And I think that's also paralyzing your vocal cord. So everything, I can unhook your neck and your head and the fascia over here, then your speech will come back. And she was worried about her digestion and having reflux. I said, it doesn't show like you have food allergies. It just feels like, the same thing that's making your neck paralyzed is paralyzing your stomach, torquing all the way down. So that's the cool thing. That's what I enjoy about manual therapy as a tool. And it's almost like if you were to read a newspaper, the next day you had to sit on a bag of golf balls and try to read the newspaper. Could you read it as quickly? Could you read it as, get the same intuition, or would you be worried about the pain in your buttocks area and how much balance you had to do? And those are like the little dings in our system. Those are the units that if we could resolve those, then we have more tolerance.
those bonus points get put back in, and then you have more
Yeah.
time. So
And then you have better healing, you have better detoxification.
we were going to talk about detox. So yeah, that's good. I remember Kanoi, a therapist that worked for me, was in a class and was learning the bone bruise technique, and she was working on one of Joe's, a therapist that worked with Joe, and that therapist had had Bell's palsy and still had a little bit of a droop. And when Kanoi fixed up the bone bruise in her talus, in her ankle bone, her face came back a bit. So
Yep.
it's just amazing how far away the hip bone is connected to the knee bone.
Yeah,
Yeah.
it's all this long chain, and we brought it back to having, or maybe she said she went through craniosacral therapy and other fascial reliefs, really liked it, and then insurance stopped, and she thought she was functional, but life brings on more dings. So every day that you don't stay healthy, every day you reach for that extra ice cream cone, or you trip and fall a little bit,
Yeah.
it adds up.
I've got a question. There's some people that that like you said, she liked craniosacral, but if the primary problem isn't in the craniosacral system, it's in a bone in a wrist, maybe that's where you work and with a better result. There's some people that I study with that are really strong in their belief that oh, it's the I don't know what you would call it, the mental, emotional, spiritual component, and that's always more primary, more important to fix up. Yet I hear them talk about, well, when it doesn't, maybe there's some unknown karmic thing. But I'm thinking, well, maybe it's just you haven't found the system in the body. Maybe it's not,
Yeah.
because there's some, if you only have, anyway, yeah, IMT has
So
a system of like going through different systems and going, oh, in this case it's bone, in this case it's artery, in this case it's a spiritual thing. Is
yeah, and we have some tools that help us map that out. We do diagnostics on all, we call them 3 different planes. We do a diagnostic on a physiological structural plane. We do a diagnostic on a mental emotional plane. We do another diagnostic on a spiritual, not meaning how do I love God, but what is my sole purpose here to be here. And we really try to ask the body which one's talking to us first. And the biggest lesson that I had, and I think my past wife Sharon discovered, was when we first became physical therapists, we really felt powerful, and we knew everything. And then we started practicing, and half the things they taught us really didn't work per person. So, and hers was, she had 3 sick children that she brought through the medical community, and they were getting worse and worse. Her youngest son, by the age 8, was going in for his 6th or 7th tubes in his ears for ear infections. And her daughter was labeled retarded and blind.
wow.
And her son had an autoimmune disease. And they only offered drugs, and she just felt, watching the kids deteriorate, she started sneaking into these alternative scary fields, which back then, which were, like voodoo things, where chiropractic and acupuncture were considered the voodoo pieces. And now we have long distance healing and spirituality, and a multitudes that other societies have used hundreds of years. And what I feel is integrated manual therapy gives you a picture. And when you have this chart of the body and you see a blackened area where there's a dysfunction, you could say, okay, let me use an herb. Did it change it? Let me use a mind thought. Let me use a prayer. And when you hit the nail on the head for that person, that whole diagnostic totally changes.
And you
So I
can
really believe.
do that real quickly. Like you could
Yeah.
like just touch it to them or think about it and see
Yeah.
does it change it.
So there's a tool that stands outside a lot of practitioners' pieces that's why I feel IMT really brings to the story, is that we have a lot of healers come in, and I always encourage them to use the tools that they've learned, but then go and see, is that person, that individual, actually really liking that piece, or do they need another piece first? And so I feel we have a improved, enhanced way of healing people, secondary to bring all those things together.
Yeah, if you find like 5 or 6 things that are a problem that could be the cause, or maybe all of them are part of the cause, but you can we have an ability to see the order of them. Like, oh, this is the most. This one will affect this, this, and this,
Yeah.
and then go from there. What do you think?
I,
Next thing. What are you? Where are you looking now? Is like, um, what's the next piece that's like, oh, we haven't looked here yet, or do you see something down the road, or where do you? I know you're like bringing in a lot of new stuff right now. Where do you?
well, I feel that when we started in the 80s and we did really structural pieces of muscle and bone and ligament, again, we've had a discussion on this. It doesn't give us the same improvement without bringing in consciousness, awareness, belief systems. So everything has been upgraded, and that was what you were mentioning with Kim, was that everything keeps changing. Well, the world has definitely changed in the last 50 years. That nothing is just stable. So the avant-garde of treating long distance and matrix is a wonderful tool to use that piece to everything should be open and flowing, and you need what you need, and you need to really look at things and to try to bind that together.
Yeah, it was so.
So there's go ahead.
Well, because we had the multiple people from many different areas of expertise all under this IMT umbrella, learning this diagnostic system to like test it, which one is the most important system to work on, and what's the thing or the technique or the solution that can affect a bigger area. And then we had a lot of different people that had different skills, and you could like, oh, that could be useful, you know, that one person's skill. And
Yep.
like the
So
homeopathy.
it's moving through that and helping the person get better um, to the most efficient way in the whole process.
Yeah.
And, and we've worked on clients together where you felt like I'm stuck with my tool bag. Why don't I go show it to Tom? And we've advanced back and forth clients many a times with, and I always like to tell people, you're not your disease. Western medicine shames you for having a disease, shames you that you got cancer, or shames you because you have this sickness. Where integrated manual therapy says, oh, here's a couple broken things. Let's tape them back together and see how you do at the end of it. And let's change the outcome.
Yeah, you know, something just came to me. I don't know why, but it came to me. So I feel like, yeah, it's years ago, I was living in San Diego. I'd go up to Vancouver, and I just had this vision, because your vision, Sharon's vision, Kim Burnham's vision, and even Ming Tong's vision, back before he had his own place, a big place, Medicine Hospital, and I just had this vision. For some reason, it was like, oh, Vancouver, and we're going to have this this medicineless hospital and bring in all the different people and do stuff. And something just kind of like struck me, because it just kind of struck me. And I thought, because I talked to somebody that knows billionaires right now, literally knows
Yeah.
billionaires, and he's very well respected. And I thought, wow, I wonder where's Yogananda? I wonder where here I am in my long john, so I'm trying to stay low here. But yeah, Yogananda had a guy named James Jesse Lyons that really loved what Yogananda showed him, which was basically how to connect to what he called Divine Mother, you know, spirit. And then Yogananda came back from one of his trips around the country doing his PR and marketing and teaching and everything. And James Jesse Lyons gifted him with the Self-Realization Fellowship in Encinitas, California. You know, acres and acres and acres on the Pacific Ocean overlooking the ocean in Encinitas, California. And I thought, I'm just putting it out there to the universe. If there's anyone that wants to go big with our dream, I don't know why, but it just came to me. So I'm just it's out there.
Thank you. And a couple of my support patients have started an IMT foundation, a nonprofit, so people can, since February of this year, we got donated a nonprofit foundation to support the education, and they funded the whole thing for the nonprofit. So we have three board members on it that are spiritually aligned in that whole process. So if anybody wants tax deductions as a nonprofit, we also have that access.
And would they get to that through info@imtwellnesscenter.com?
Yeah, they would ask me. I haven't put it up yet because we sort of got inoculated by the virus. But
Okay,
that's yeah.
I'll just put that into my notes here and then share that. Wow, then that's no wonder that I was tracking that. Very cool. Yeah, we're definitely in a reset of some type, huh? We'll see.
Yep. And as we've been friends and studiers together, yeah, it's called the IMT Donor Foundation. As we've studied, throughout the years, we were always chasing the question, how can I help my patients get bigger and better? And it's been interesting to watch how these, like craniosacral was really big and then it came down.
Yeah.
Traeger came up and came down. All these different educations and philosophies are ebbing and flowing through this whole mass. And even IMT has a compression period that we're coming out of again.
Yeah.
And when I went to chiropractic school in 1989 was my first class in that. And as the dean was welcoming the 60 of us to become chiropractic physicians, said this is a remarkable year. And because we started chiropractic schools were founded in 1890 and now it was 1980. And it was the first year that this incoming class were students that were coming to chiropractic as because they respected the field as a healing art instead of having an uncle or aunt be trained in it, and they were just following in their family footprints. So it took 90 years for that medicine to really become established. And the same thing happened with osteopathic and naturopathic medicine. They were humbling and hobbling along, and people were studying it, and they finally found a foundation. It's almost the 100th monkey theory.
Yeah. Maybe that's why Qigong has lasted so long. It's got a 5,000-year history.
Yeah, and the mastery of that. And, we're with the new advent of the internet and this world knowledge that we have. One news reporter was reporting this morning that 650 million people were affected by the Spanish flu, and we're only at 3 million people affected by the COVID virus this year. And we have the knowledge, and we're watching our sciences crumble and not keep up to the answers, and we could be aware of some of the blindnesses that are going on at the same time.
Yeah, there's a different way than just fighting it all.
Yeah. However, I would like to say that if people still have allergies to natural pollens or intolerances, the question is why or why not? Are they premium optimal people and they're aware of the sicknesses, or are they have some pulls on their system that make them less optimal?
What is that? Is it like is it an either or do you see it both ways, or what do you? Because that's a big question. Like, are you healthy enough to handle the toxins of the world, and that means you're healthier, or are you just toxic so you can be around all the toxins of the world?
Correct, but I would say a tree pollen should be something that may not affect you.
Yeah, yeah.
But if it's DDT or Roundup, yeah, I'd get sick from it at the same time.
So there's yeah, if it's from God, natural. Yeah, that's good.
And my question, and if you watch, if you have those dings in your body, and as I watch people heal through the IMT process, their allergies disappear, their asthma disappears. It's like saying, okay, why wasn't the liver taking these toxins out? And how do I make sure that the liver has enough room to work? And then it doesn't have enough building blocks to actually do its job. And again, like even the simple thing of PMS, you know, premenstrual syndrome of women is ridiculous nowadays. And it's, I feel that 80–90% of the women that are having trouble, you know, I'd like to see there's some mythical women out there that can go their 28 to 30 days and notice that they're menstruating and they don't have a cramp. They don't have the emotional pieces.
Yeah, Jen, and I know my ex-wife Shannon, who you knew and worked on, she had so many allergies and asthma and cried, and we had to go to ER sometimes, and had to give up a cat. And she got rid of all those allergies and asthma, got rid of all of her drugs, ran a 3:29 marathon, and got a cat.
Yeah.
We also got divorced, but that's okay. Yeah. So, and I remember for myself, one of my goals with integrative manual therapy when I first started was to get my liver healthy enough so that I could drink more coffee. And I got there.
Yep. So it's a question on are we optimal and how does it work? And you know, health. And I have my son-in-law was using an asthmatic inhaler 3 to 4 times a day, and about every 2 weeks having to go to the ER for a treatment. And when he started going out with my stepdaughter and dating her and moving over to healthier foods, he hasn't used that in 4 or 5 years, and come to find out that he had a shellfish allergy and his mother was allergic to shellfish, but he was so toxic he didn't know, you know, where it was coming from.
Yeah.
So yeah, it's a really cool place to be, but the not to, in the vaccine trilogy that they were talking about, they were even talking about using Tylenol, acetaminophen, and how that's changed livers and made people more toxic. Yeah. And I don't think you have this, and I don't have it. I know I don't have a bottle of Bare aspirin or Tylenol or Excedrin in my, I have never used them since 1985, right? So, and I've maybe had 3 or 4 headaches and had a little body work or went to sleep, but they never persisted over days. And I feel people that suffer that way, if we have the time and we can do the things that can 90% be reversed with body work and good nutrition.
Yeah, and it's like there's different ways, and if somebody wants to go the regular medical route, that's their call. But it's really cool to let people know that there's this other way that line with the body. So thank you, Tom. Man, this was an awesome session. So
well, I hope you get over your technology allergy.
So too, yeah, it went weird today, but it is streaming live on my Beyond Limits Facebook group, and it's being recorded. So I'm going to put it on YouTube. And I told everybody on the email list that it'll just be on at 11:15 our time. So, you know, an hour late, but so it'll be recorded. So that it was a great one, and I'll share the nonprofit stuff. And awesome to see you. Really good to see you.
All right, buddy. We'll talk next time.
Okay. Thanks. Good. Thanks, Tom. Really good. Bye now. All right, you guys. We'll see you next week.